Hi you guys, welcome back to my channel. My name is Jennifer and I wanted to do an update about my iron infusions. Now my channel is about my weight loss journey where I've lost 100 pounds from having weight loss surgery. I had VSG surgery back in 2017 at a high weight of 261. And then about a year ago, I had a revision to gastric bypass because of having really severe acid reflux. And so I'm now like a little over 4 years post-op of having a weight loss surgery. But I've been having some health issues, and one of those health issues is becoming very, very anemic since having weight loss surgery. And this is kind of a very recent thing where my numbers have been kind of declining, and then all of a sudden they just tanked. And I've just been feeling so like terrible, tired, sleepy, poor concentration. My hair has been thinning a lot, but I also have a thyroid disease. So I actually thought it was my thyroid disease. Well, so I went to the doctor and they prescribed, or she just prescribed getting 4 iron infusions. And so I've already done a couple of those. And so I was put on a medication, or the iron infusion is called Venifer. And right now, before starting the iron infusions, my ferritin was at 4, my hemoglobin is at 11. So the biggest problem for me personally is low ferritin. Now, the first time I did it, there are always possibility of side effects when you do anything like this, right? And I am a side effect girl. I get every side effect, every complication. I usually get just about everything. I have for my whole life. I've been that person that just gets everything. Well, the first infusion I got with Venifer, I had some very, very mild symptoms, like really, really mild, not anything to be of great concern, but I was conscious of it because I knew that there could be like allergic reactions. And so the things I was looking for was like itching, shortness of breath, cough, like anything, basically allergic reaction stuff. Well, so just mild stuff I felt. And so when I went to get my second one, like later in that week, which is last week. So the first one I did was last week on Monday, and then on Friday I had my second one. So I let them know that no, I didn't really have any side effects. Everything was fine. So I did my second iron infusion on Friday. That went off without a hitch when I was there. But I noticed, so what they do is you do for the Venifer, it was only a 15-minute drip of the IV, and then you have to sit for 30 minutes. Well, I did notice while I was sitting there that I was starting to get, this is going to sound so weird, but the tip of my nose started to get itchy, but I wasn't sure if it was just because I was wearing like a different mask, because they, when you go to a medical place, they actually provide you a mask. You have to wear their mask. I wasn't wearing just like my normal one. And so I wasn't really thinking of anything of it. And so I didn't mention it to anybody. And then I got in my car, and as I was driving to work, I started getting like this really severe burning sensation in my palm, enough to where I was like rubbing my pants with my hand because it was really burning, as if I had like put my hand like on like a hot, like almost like a stove, but didn't quite touch the stove, but was like hovering too close where it was burning significantly. And it was my left hand, and that's the arm that I had the infusion, the IV in. And so I was like, okay, that's kind of weird. Well, then it actually moved up my body, and then like the top of my head started to burn and kind of get a little itchy, and it actually went down my face, and I started to get like tingling in my lips and my tongue. But that's actually a common side effect that I get from my thyroid disease too, but it was very kind of like related. It was all kind of related. And so I'm like, okay, that's a little weird. And then my face was getting a little tingly and a little itchy, but it wasn't really, too significant. It was just like, oh, that's weird. And so I got to work, and it actually continued for 4 hours plus, over 4 hours, enough to where by the end of the day I was like, I think I'm just going to head home a little early because I was very, very fatigued, very, very tired. That's one thing the iron infusions kind of did to me, is they made me feel kind of sleepy, even though I wasn't taking like any Benadryl, which sometimes they do advise people to take Benadryl before doing an iron infusion. But so I just went on yesterday, Monday. Actually, today's Wednesday, so it was like 2 days ago. On Monday, I went to get my third of 4 iron infusions with the Venifer. And as I was walking in, the nurse was asking me, how I was doing. Did I have any side effects? So I did mention to her that I had these side effects, and she was very alarmed. Where I was just like, okay, well, it's not that big of a deal, to me. But turns out that with Venifer, it's that a lot of times apparently they use the Venifer iron infusion in the bag because it tends to have low side effects. And apparently the side effects could be accumulative and progressive. And so the fact that I had already had side effects the second time, that I had very few the first time, I had more the second time, they didn't want to risk what would happen the third time. And so they ended up having to consult with my doctor. The doctor had to consult with the pharmacist. So they ended up scrapping the Venifer, which is only a 15-minute drip with a 30-minute observation, to put me on a different formula of the iron stuff. And I don't remember what that's called. I'll put it down below on what that one was called. But that one actually required me to do a test dose. So the test dose was just like the Venifer in terms of it was 15-minute drip with a 30-minute observation. And then I had to do a bigger bag of, it was like a full hour drip and then observation. But they actually had me take Tylenol and Benadryl before the test dose. So I arrived at 8:15 in the morning, and due to the delays in trying to get a hold of my doctor and the doctor consulting with the pharmacist and then doing the test dose and doing all that. So I ended up not leaving there until 1 o'clock. And so it was a long day, but I got my last two, what should have been my last 2 doses of the iron infusions, they wrapped it up into 1. And so now I'm done. I had 3 total infusions, 2 with Venifer, and then this last one with whatever that other was called. I'll find out, and like I said, I'll put it down below. But I don't know if it's psychosomatic, but I can really tell a difference with this third one I just did. I am sleeping really good. I'm waking up like before my alarm clock. I'm feeling very refreshed. So I'm really hoping that it worked, and I'll put some footage of that at the end of this video. But I'm really excited. I'm really hopeful. So now, 30 days from Monday, I will get my blood work and see how my numbers look, and I will of course update you guys. But I so appreciate all of your support, and if you are having issues with unexplained energy or hair loss is a big deal with low iron, ask to get your levels checked, your iron levels checked, and especially ferritin. Apparently ferritin is not often ordered in the blood work, but that's a really important number to have. So I guess that's it, but overall I'm feeling really, really good. Sorry I actually look very pale right now. I don't have any lipstick because, you know, at my job, this is what I look like. All day, that's what I look like. So anyway, thanks you guys for watching. Please like and subscribe and leave a comment. So much for watching, and I will talk to you guys later. Bye.